I'm Ben Winslow in Salt Lake City. Medical cannabis patient advocate groups are expressing concerns about changes to Utah laws surrounding the state's program, and they have fears it could scale back people's access.
The medication I've been using for years, so I've known that it's already working for me.
Chris Lott has had his medical cannabis card for years.
Have some peace of mind that I'm actually obeying all laws at all times.
He got it here after trying with physicians elsewhere. He says this is cheaper.
I have found some things as far as physicians not following through or being consistent, or nowhere that is reliable where I can renew my card year after year for a price that is something more reasonable.
But a recent law change has frustrated some medical cannabis pharmacies and patient advocates. Lawmakers have now scaled back where prospective patients can get a medical cannabis card.
It doesn't allow us to have temporary events like our 420 market event on Sunday, where we can bring medical providers, engage with the community, have people ask questions about medical cannabis.
Utah's laws require a qualified medical provider be the one to recommend cannabis, but patient advocates complain not enough have actually undergone the training to do it.
In essence, we created pot doctors when we were trying to avoid pot doctors. But the QMPs that we have been excellent, and I mean, they're regular doctors. This is just something else they provide, and coming to a pharmacy to provide it is just better access for patients.
Dragonfly partners with Utah Grown, and that's still allowed under the law. But the Utah Patients Coalition fears the law change will reduce access for people.
When you put up the barriers to access the medication that we desperately need, is that you open windows into the black market.
One of the lawmakers tasked with running cannabis legislation on Capitol Hill tells Fox 13 News the statement this is going to drastically limit access is more sensational than in practice. House Minority Whip Jennifer Daly Provost says she doesn't want to limit access, but too many are not accessing their prescriptions with their healthcare provider, but through somebody they've never met. This year, lawmakers also reduced the requirements for medical providers to recommend cannabis.
I think most people are generally nervous to have these types of conversations with their primary care physicians because traditionally speaking, cannabis has been illegal. It is legal. It's recognized as medicine in our state.
Now, this weekend is 420, the unofficial marijuana holiday. A lot of medical cannabis pharmacies are planning events to raise awareness about patient access. In Salt Lake City, Ben Winslow, Fox 13 News, Utah.